Hello everyone, my name is Shelby. Thanks for coming tonight. Think about all the things that affect our breathing, from toxins such as cigarette smoke to minor things such as pollen or even the air we breathe in every day. Some of us can tolerate it with minimal problems, and others could be greatly affected with major complications. Now, these complications that could occur do not apply to everyone. However, you might be surprised to know that many older adults can experience symptoms of asthma for the first time. Not all symptoms or diagnoses are shown in the early stages of life. Due to asthma being a very common chronic disorder in both children and adults, the Center for Disease Control and Prevention, also known as the CDC, has estimated that more than 25 million Americans have asthma. With that being said, for the last week, I have done extensive research on asthma and have obtained any and all information relevant to what I'd like to inform you about today. The information I have gathered allowed me to review exactly what facts I could include based off of your knowledge on this topic. And according to the survey I have distributed to you all, 6 out of 10 who answered know someone with asthma, and 100% of you know the common symptoms of asthma. With the research I have done, today I would like to inform each and every one of you about specifically what asthma is and its causes, the symptoms and triggers associated with asthma, and what treatments are effective in controlling one's asthma. According to the American Lung Association, asthma is described as a lung disease that makes it harder for air to move in and out of your lungs due to inflammation. This inflammation causes your airways to narrow, producing extra mucus and difficulty breathing. People who have asthma may experience symptoms that range from mild to severe, and that may happen often or rarely. Chronic asthma can lead to an asthma attack, in which the muscles surrounding your airways tighten and cause even more trouble breathing. Asthma can affect people of all ages, but most often starts in early childhood. According to the 2012 article titled The Gale Encyclopedia of Fitness, written by Jacqueline L. Long, the onset of asthma can be described in 3 different ways: childhood onset asthma, adult onset asthma, and exercise-induced asthma. Child onset asthma is the most chronic disorder in children. Children often experience symptoms of asthma due to respiratory infections, excitement, exposure to cigarette smoke, cold air, or changes in the temperature. Adult onset asthma is more than likely due to allergies and sensitivity to triggers found in the workplace that expose chemicals from plastic, solvents, or wood dust. Exercise-induced asthma is generally something that happens to those that are not affected by the typical environmental triggers. Exercising in cold air or doing aerobics activities for more than 10 minutes can trigger exercise-induced asthma in those who are prone to it. Also, certain pollutants or chemicals can make the asthma attack much worse. Now that we've discussed what asthma is, I'd like to begin going over the many different symptoms and triggers associated with asthma. There are many different symptoms that can arise from asthma, some of which are commonly known and others that occur in only half the amount of people diagnosed with asthma. One of the more common symptoms is wheezing, which is a whistling or squeaky noise coming from your throat when you're breathing. According to the American Lung Association, this sometimes only happens when you exercise or have a cold. Another common symptom is frequent cough, and like wheezing, this also only sometimes occurs when having a respiratory infection, such as the common cold, or during exercise. The cough is usually more frequent at nighttime and could cause an individual to cough up mucus. A more common symptom in children rather than adults is difficulty or fast breathing, causing the skin around the ribs or neck to pull in tightly. The Mayo Clinic website has stated that exposure to various irritants and substances that trigger allergens can trigger symptoms of asthma. Also, asthma triggers can vary from person to person, but some include pollen, pet dander, the common cold, physical activity, cold air, pollutants such as smoke, certain medications including aspirin and ibuprofen, along with more non-common triggers, like strong emotions and stress, and sulfates added to some types of foods and beverages. Not only is asthma triggered by these examples, but asthma can also be inherited from a blood relative. There are many different symptoms and triggers that are associated with asthma, and since asthma is a treatable condition, knowing how to control these effects is very important for good health. Now we will get into the many treatments that are available. Since asthma is not curable, those who live with this disorder and battle symptoms on a daily basis need a treatment to control the effects it has on their body. In Jacqueline L. Long's article, medication is primarily used to treat the symptoms I've discussed previously. These controlled medications, also known as inhaled glucocorticoids, which is a fancy name for steroids, decrease inflammation of the airways over a period of time, limiting the amount of attacks that may occur. Other medications, such as long-lasting bronchodilators, combined with the inhaled steroids, help prevent attacks from occurring. There has also been a pill form alternative drug to help control symptoms, although the pill form is not suggested for more severe cases of asthma. When a person is having an asthma attack, albuterol is the more common inhaled medication used in the United States to subside the attack quickly by temporarily relaxing the muscles in the airway, as opposed to the inhaled steroids, which help to prevent the attacks and/or symptoms of asthma. According to the National Heart, Lung, and Blood Institute, it is not common. However, those with severe asthma that cannot generally control the attacks or symptoms with the medications I've mentioned, some doctors will suggest a procedure called bronchial thermoplasty. For this procedure, the doctor would enter the airway with a scope and apply heat to the muscles along your airway to make them thinner and to help prevent constriction. As stated before, asthma varies from person to person, and treatment is recommended according to the severity of your asthma. Now that you've heard all the information I was able to share with you, I hope this gives you a better understanding of how significant asthma is and just how many things from severe to mild affect those with asthma. Knowing exactly what asthma is gives you a better understanding of what one goes through on a daily basis. Knowing the symptoms and triggers of asthma could maybe help you encourage anyone you know to seek treatment for any questionable symptoms they may still have, and knowing the many different treatment options to control this condition. I'm done.